Welcome to the HealthWise EMR module training. This course is designed to provide you with a better understanding of the EMR module and other HealthWise solutions that contribute to the patient education experience. At the end of this course, you will be able to describe the key features of the EMR module, list the 4 types of education materials clinicians can prescribe using the EMR module, and describe the various methods a clinician can send educational materials to a patient using the EMR module. Let's begin by defining EMR. EMR stands for Electronic Medical Record. An EMR contains the standard medical and clinical data gathered in one provider's office to diagnose or treat a medical condition. The HealthWise Patient Education EMR module is a pre-built, secure, easy-to-integrate web application that integrates with a variety of EMR platforms, including eClinicalWorks, Cerner, and Allscripts. The EMR module allows clinicians to deliver patient education at the point of care within an inpatient, outpatient, or emergency department setting. Let's watch a short video to better understand the concept of point of care.
We get it. It's not easy. Lowering costs, increasing satisfaction, and improving outcomes. But by delivering meaningful experiences at every patient touchpoint, you can do just that. HealthWise for Point of Care integrates directly with leading EMR platforms such as Epic, Cerner, and Allscripts to fit seamlessly into your organization's existing workflow. Each patient's diagnoses and demographics generates tailored health education recommendations chosen from thousands of consistent evidence-based materials available in multiple languages. You can choose from patient instructions for specific episodes of care, videos that engage while they educate, decision aids that capture patient preferences while helping them understand the risks and benefits of different treatment options. When you're ready, simply print or send electronically. Patients access the relevant, easy-to-understand materials on any device, anytime, from any place. And you can empower patients with health education and tools directly within your patient portal, putting high-quality content right at their fingertips. Your patients can read important information about how to care for themselves or when to call for help. Watch informative videos and use interactive tools to help them make informed medical decisions. The interaction comes full circle when patient activity is tracked and reported back to your clinicians, who can see what material patients viewed and what responses they gave. This insight helps your clinicians prepare for the next visit, resulting in better doctor-patient relationships, more tailored care, and better informed clinical decisions. Meet meaningful use criteria for virtually every moment in care, and support the latest accreditation requirements, including Joint Commission and PCQ measures. So when you're ready to amplify your impact at every patient touchpoint, HealthWise for Point of Care is there to deliver engaging health education to patients anytime, anywhere.
Clinicians can use the EMR module to search, view, print, and send patient education materials at the point of care within an EMR. The EMR module generates a contextually relevant search result list based on clinical data and patient demographics, including age and gender. Clinicians can also search by code or keyword, as well as browse content by category or an alphabetical list, and then create a queue of documents for printing or electronic distribution to the customer. EMR module integrates with electronic health records and other primary clinical applications using the HL7 International Context-Aware Information Retrieval, or InfoButton standard. For best results, diagnoses should be accompanied by ICD-9 codes, labs and procedures should be accompanied by CPT codes, and medication should be accompanied by NDC codes. Search results are grouped by main search concept, allowing clinicians to quickly identify topics relevant to the concept they want to educate patients about. Let's watch a short video about the info button.
We were doing a research pilot with the Department of Defense, the military health system. We were trying to figure out how do we take this patient education content and these applications we've created and get them into the provider workflow so that doctor or nurse can routinely and consistently provide patient education as part of the healthcare delivery process.
I think in the health informatics space, patient education was not a big focus. It was more about billing codes and how to get systems functioning together and getting the money flowing and information flowing. It was not really for the benefit of the patient, and that has shifted significantly, and it feels like we have been at the forefront of a more patient-centric health system.
I took a team and we went to several different clinics, and what we found right away was that they were just too busy. So I started looking around for kind of a standards-based way to automate some of those workflow components, and that's when we came across Info Button.
It's called Info Button because to the user it ends up being a little button in their medical applications where they can get more information about something. The idea was that when you click on this, you can get patient education material, and that was what drove HealthWise.
So we used that to automatically surface the patient education. In the process of doing this research, we created a message that was compelling enough that it actually went into the meaningful use requirements for electronic health records. We weren't expecting a patient education provision to be in there, but it was. And when I saw that they had included a requirement for patient-specific education and how closely it mirrored the research language that we had developed, I just realized that moment, we just changed healthcare. The way everybody does healthcare is going to change because of this work that we've done.
The EMR module delivers patient education resources in a variety of formats that meet meaningful use criteria for virtually any moment in care. Clinicians can also view the patient's responses and interactions with the content to improve shared decision-making. HealthWise requires the following information to electronically send information to a patient: a patient identification number, last name, date of birth, and patient's email address. Clinicians can prescribe 4 types of educational material using the EMR module: patient instructions, prescription drug leaflets, shared decision points, and videos. Let's take a closer look at each type of educational material. HealthWise has created over 3,500 patient instructions, known as PIs. All PIs are available in English and Spanish, and the top 250 PIs are available in 13 languages. Patient instruction documents are generally 1 to 2 pages long and provide detailed information about how the patient can find additional content in the HealthWise knowledge base, which is installed separately on a clinician's website. Clinicians can print or electronically send patient-specific education materials using the EMR module, and patients can view electronic patient instruction documents using HealthWise Communicate from a patient-specific hyperlink. Included with HealthWise patient instructions is the Go to Web feature that lets patients who are reading HealthWise printed materials easily access online knowledge-based topics for related information. The printed URL address takes the patient to a web page where they can begin their interaction with a website that is hosting the knowledge base. HealthWise provides over 1,700 Cerner Multum drug leaflets for over-the-counter and prescription medicines. Drug leaflets are available in English and Spanish. HealthWise Shared Decision Points are online tools that support client preference-sensitive healthcare decision programs. The shared decision points are based on standard decision points with additional functionality for consumers and clients. HealthWise has created over 600 videos about various health topics. HealthWise is currently converting all videos into Spanish, either produced with Spanish audio or English audio with Spanish subtitles. The EMR module interface lets you locate, customize, and print educational materials. The interface contains several tabs, as well as the preview and print windows. When a clinician launches the EMR module, the Suggestions tab is populated with patient-specific documents based on factors such as age, gender, diagnosis, and medications. You can browse through and select one or more of these documents, or use the Other tabs to locate other relevant documents. The New Search tab lets you locate patient instruction documents based on a search term containing text, numbers, or both. The EMR module searches on document titles, keywords, synonyms, and codes including ICD-9, ICD-10, CPT, SNOMED, LOINC, and RX norm codes. You can also filter by age and gender to further refine the topics in the search results. You can browse for topics using the A to Z tab. Select a letter from the alphabetical list to display all topics beginning with that letter. Patient instruction documents are grouped in clinical categories such as allergies, trauma and injuries, diabetes and endocrinology, and so on. You can browse for a document using these categories. Since the EMR module displays both clinical and consumer categories, the same category name might appear more than once in the list of categories. You can create lists or folders to organize documents that you frequently use. You can quickly access these documents from the Favorites tab. For example, you might create a folder for a specific condition, such as hernia or asthma. You can store a document in more than one folder, but you must save the document to each folder. The EMR module does not support individual user accounts. However, it is possible to support individual user preferences by configuring the client or group features appropriately. For instance, administrators can create folders for individual users, and each clinician can save lists of frequently used topics. Additionally, users can create notes and text snippets for consistent messaging across patients. Patient response is an optional feature where clinicians can view individual patient responses and progress towards reading educational materials and completing tools. You can preview the documents in the preview and print window of the EMR module. After you locate a document, select the document title to view the content in the preview and print window. Clinicians can add notes to a printed or emailed package of educational materials from the preview and print window. If you want to send or print multiple documents, you can hold a group of the documents to send or print as a batch before adding the note. Custom notes are included as the first page of the document package, and clinicians can save frequently used notes. An optional feature in the EMR module is real-time editing that provides clinicians the ability to edit the text in HealthWide's educational materials prior to delivery to the patient. Situations where a clinician might edit a patient instruction include adding information about a required medication, removing a treatment option that is not covered by the patient's insurance, changing a biometric value specific to the patient, such as blood pressure or glucose levels. If a client wants the real-time editing feature enabled, HealthWise must add the feature to the application key. Clinicians can print documents for patients from the preview and print window. Clinicians can also hold several documents, add a note, and print the documents as a package of related documents. Clinicians can select and hold multiple documents to send or print at one time from the preview and print window. After the clinician selects and holds all the documents to send or print, he or she can add a note that is included on the first page of the document package. Clinicians can send documents to members via email from the preview and print window. Before a clinician can send a document, he or she must either open the document in the preview and print window or add the document to the list of documents on hold. If the email address is included in the patient's information, the document is sent to that address. If the email address is not included, the clinician must manually enter the email address. Clinicians can hold several documents, add a note, and send as a package of related documents. For more information about the EMR module, refer to the following resources: EMR Module User Guide, EMR Module Product Implementation and Administration Guide, EMR Module Frequently Asked Questions, EMR Module Delivery and Interface Option.